Hi, what's up, guys? Welcome back to another interesting episode on the show Behind the Scenes in Health with Dr. Ron. And if you're seeing me for the first time, my name is Ronald, and on this channel, I talk about healthcare, health tech, alternative careers, every interesting stuff around medicine, And if that's kind of thing you're looking for, then you're in the right place. So just hit the subscribe button, and yes, let's dive into the conversation. Now, a couple of months ago, I had a session with Dr. Lulu Jubril, who is a doctor and has transitioned into health data science. So he's working as a data analyst in the healthcare space, where he shared his journey and all of that, what he does on a day-to-day basis. And I just thought it was wise to, do this short video to talk about the schools where you can actually study health data science. If you're looking at the UK, we have the ones for other countries coming up as soon as possible. So health data science, a brief overview, basically it's the application of data science techniques. You analyze large data sets in the healthcare space, the aim of which is to derive insights that will help you improve healthcare outcomes, improve service delivery ultimately. And that involves things like data collection, data cleaning, pre-processing, analysis, visualization. Just at the high level, that's what health data science usually encompasses. So I'll just talk about some of the schools in the UK who offer health data science, how long the program is, IELTS requirements, what the school fees, and if they have scholarships available for anybody who is looking to get into that space. So, and it's also worth mentioning that for some unis or universities, they usually want you to have either a mathematics background, statistics background, computer background, or physical sciences background. That being said, I know doctors who don't have all of these backgrounds. They are coming from a purely medical perspective and they are moving into health data science. So yes, you can actually get into that program. So the first on the list is the University of Manchester. So they offer a 1 year full-time program or a 2 years part-time program, which is full-time, really, meaning it's in person, really. And for you to get into the program, you should have your first degree, first of all, in healthcare related degrees and all of that. So it could be a computing degree, statistics degree, healthcare degree, that's fine. And in addition to that, you need an IELTS score of 6.5 overall, minimum of 6.5 across all the different bands, quite dicey. So in terms of school fees, they are asking for £31,000. This is for international students as at the time of doing this. And if you're doing the part-time, they usually split the fees into smaller chunks for you. So full-time fees, that's what it's here, £31,000. And are there scholarships available? Yes, there are. So you want to check out the University of Manchester website for that information on how to get those things. So it's good to, part of the requirements they also mentioned was, you should have, what do you call it now, significant experience doing analysis of data and all of that, which you can easily get. I mean, I've done videos about how you can get into health data science or get your hands dirty on data analysis. So you want to check that out. So the next school is Swansea University. Yay! Why am I excited? Well, I actually finished from Swansea University, but it was for health informatics. So they also offer health data science, either 1 year or 2 year part time, and it's usually in person. Swansea is in Wales, very lovely place. You need to visit that place, right? So for IELTS, you should have a 6.5 with a minimum of 6 in each component, and this is in addition to your first degree in healthcare or computer science or bioinformatics. You should have an experience of analyzing data, so that comes in handy. So you probably want to look at this critically and also find a way to capture that in your supporting statement, right? In terms of fees, you're looking about £20,800 for your tuition. And are there scholarships? Yeah, they offer a couple of scholarships. So you want to check out the website for the details on how to access those scholarships. It's quite competitive. The next one is Plymouth University. It's 1 year, 12 months intense. It's in person. In addition to your first degree, you also need an IELTS score if English is your first language. So 6.5 with minimum of 5.5 across all bands, and the school fees is 19,800. Yes, that's for international students. So home students pay less, about £10,500. Scholarships are available? Yes, there are. So you want to check out the website for that. And the fourth one is Lancaster University, where they have a full-time program, 12 months, or a part-time, which is 24 months, usually in person. So you have to be in the UK to do that program. What are they asking for? 6.5 overall in IELTS, listening 5.5, reading 6.0, speaking 5.5, writing 6.0, and the school fees is £29,000 for full time. If you're doing part time, you do half of the fee, but ultimately you get to pay the sum of £29,000. Do they have scholarships? Yes, they do have scholarships. So you want to check out the university website on how to access those scholarships. From my experience, I think those uh, scholarships are quite competitive. So there are different types you could apply depending on university. So you could just give it a shot. And the last one is University of Aberdeen in Scotland. Aberdeen, Scotland. So they've got a 12 months or 1 year program or 24 months part time. It's usually in person. You need 6.5 in your IELTS with let me check. Yeah, 6.5 IELTS, and the school fees is £23,800. They have scholarships. Yes, they have. So you want to check out the websites on how to get those scholarships. So if you're looking to get into tech or health tech, transitioning, so and you love playing with data, quantitative data, most especially, then you might want to consider health data science, and the opportunities are endless. I'm not sure if I have a video. I think I do, but I'll check. If I don't, I'll talk about the different opportunities you have as somebody who has finished a program in health data science. So if you've got any comments, if you've got any questions, put them in the comment section. Reading, I'm listening, I'm trying to comment and reply you. And let me know what you think. And for those who are looking to get into this program, I hope this has been informative as much as possible. And like I usually say, this list is not exhaustive, it's just for to get you started. Right. Thank you guys for watching, and I'll see you in the next episode. And bye for now.